at first I have to say that I had 3 project ideas and I haven't decided yet, so I just basically on a random sample picked one that I present because there's no time to present all 3 of them. So I went with my initial idea, which was risk management and new product development in the medical device industry. And the question why I came up with the topic, well, first of all, I've always been, this wrong, for a long time I've been interested in healthcare and especially medical devices. And I've worked in healthcare, as most of you know, and I've previously written my bachelor thesis also on medical devices and their regulation. And I found out in my initial literature review that risk management has been a topic in new product development for pharmaceuticals. There's been a lot of stuff done in that, but not so much for medical devices. Or, I mean, I haven't found anything on it, so only partially. So I guess that's a research gap. And what might be irritating at the moment, or needs to be stressed out, is that this is not about the risk that the medical device actually poses to the patient, which is like the most obvious risk, like the product risk itself, which I just described at the golden graph, and that's obviously a risk that the product itself poses. The research is about how the new product development process is, like how the risk is managed in the process of new product development. And for the risk of the product itself, there's anyway an ISO standard, which is this one, it's 84 pages and not very entertaining, but like all the medical device manufacturers have to follow that standard anyways in order to get approval later for their products. So, and I guess if I would focus on the product risk, it would not fulfill the requirement of the course because it would be engineering or biochemical stuff. Okay, so what do I plan to do in my research? Well, first of all, obviously I want to identify the risks that are associated with the different steps of the new product development life cycle, which are these. And then I want to see how risk, or if and how risk is managed, because there are several teams involved in the new product development, which are these. And not all of them are involved in every stage of it, but for most parts, several teams are always involved. And so the question is, how is risk managed in each phase? And is there maybe a phase where there's a lot of emphasis on the risk management, while other phases are a little bit ignored? Who knows? That's the question. Okay, so how am I planning to do that? So obviously I already started doing the literature review, and I would continue that and maybe look how the similar studies for pharmaceuticals have been conducted. So I mean, people did exactly the same, only for a different product. So I might just kind of copy the way they went in order to evaluate the risk management, because also for pharmaceuticals, the new product development steps are almost the same. There are more loops, and obviously there's a chemical involved, so that's a little bit more complicated. But if I only focus on the risk management in the process itself and ignore a little bit what type of product it is, then it's rather similar. So I might just like try to have my research methodology aligned with what has been done, kind of not copy, but use that as a guidance. Let's say it that way. And so at the moment, I mean, obviously this is only one of 3 ideas, so I haven't really settled it, but I was thinking about semi-structured interviews, and there are several people I know, either from working before for Siemens, or from my other research that I did, or friends and family who work for medical device manufacturers. And yeah, obviously we're all on LinkedIn now, I guess, and there are also networks for medical device manufacturers, so I could use them. Alternatives would be rather to do the interviews, do a survey. I'm not really happy with that option because I would need to make sure that enough people from each group, like from each team involved in each, like, okay, I come to the progress later, but the other option would be a survey or like do a case study kind of approach. comparing how the risk management for the pharmaceuticals is done, and then try to draw conclusions to how it should be done for medical devices, because apparently for pharmaceuticals it's kind of successful.
Okay, we need to compare the side.
And the research problems that I'm foreseeing here is, first of all, my supervisor has serious doubt about the value of my research, as it turns out. Also, he's missing a research question and thinks that the scope is not really figured. I agree to that. The value thing, well, we can discuss about that. Then obviously I'm dependent on a large amount of people. If I'm in the end missing out of one team or like one phase, I only got like one interview or no response to the survey, it's kind of pointless. So that is really, at the moment, the biggest problem with that kind of idea I have is that there are so many, so we have the life cycle and we have all the teams, and to make sure that it's all there in the end is kind of a little bit mission impossible, I guess. And yeah, then, well, I mean, obviously it is a project, but I have to check whether it meets all the criteria. I haven't checked that yet, but that should be ensured, I guess, before I continue with that kind of idea. And then also I haven't really looked at what the stakeholder influence is and what the stakeholder value in this case is as well, and how it's perceived, whether it's valuable. So how do the stakeholders influence my whole new product development? And also there are different regulatory requirements for medical devices in each trade region. So I'm not really sure whether a device manufacturer in Europe would approach the whole new product development differently because of regulatory requirements. So, yeah, that's basically it for now. Sorry, Ned. Should I give you? That's okay. I can. If you want, I can give you the real quick overview, like a few sentences. It's about risk management and new product development for medical devices. I skipped the why. I wrote previously big interest. This might be interesting. The research is not about the risk that the product poses to the patient. It's about the new product development process, like how is that.
Excellent. That makes it relevant to the degree yet.
Okay. The research aims, so we have the new product development life cycle, and yeah, I will try to identify the risks which are associated with each phase of the life cycle, and then explore if and how these risks are managed by the teams involved, which are the following. No, wrong. So I've already done literature review, and I figured that a lot of stuff has been done on risk management and new product development for pharmaceuticals. So I would continue to review that and try to maybe align my research outline with what has been done for pharmaceuticals. So kind of like.
Well, it's at the top, is it focused on similar studies in pharmaceuticals? I would say that is a case study, I'd say.
Okay.
You know.
No, what I meant with that is more that maybe look how they approached the topic, like what was their research outline? Did they do questionnaires? Did they do surveys? What you know, just rather than like trying to make up all from scratch, I like pick a little idea, a couple of ideas from what has been done in pharmaceuticals. There has nothing been done in medical devices, so I can't really look into that, but that should give me some inspiration.
Are there any, I mean, if you were to contact Siemens, now Siemens will have all sorts of procedures.
Yes.
Well,
maybe not so much Siemens USA, where I worked. I mean, if I would try to get into Siemens Germany, I'm pretty sure that there's all kinds of stuff, but in the past my colleagues have been rather helpful, and like, I mean, I've done previous research in medical devices, and I mean, I had to fill in one form that, I mean, there are no disclosed information and I won't share it, and I keep the results of my...
You may well find, and of course, the university will not publish it outside the university, and it will not be made available outside this university. So you can put confidential stuff in with, you know, genuine reassurance to the providers that this is kept in confidence.
Yeah, what you also missed is that this is only one of 3 ideas I'm currently having, and I haven't really decided, so I'm only presenting one.
Oh, I'm aware of that.
Okay, yeah, we talked about that last time. So yeah, I thought about these semi-structured interviews, and there are other options, obviously, surveys, case study. And then the problems I'm foreseeing here are several. First of all, that my supervisor does not see value in my research topic. There's no real research question yet, and no objectives. I mean, I have aims, but not really objectives. The scope might be too broad. This is like the biggest problem I'm foreseeing. I'm dependent on a lot of, like, I need a lot of response because we have all these teams and we have all the stages of the life cycle, and I would need information to
Sorry, that's me.
Okay, the rest has heard that part, so I guess I don't need to go over that again.
I'm worried that it's becoming a continuation of your bachelor's degree.
No, it's not.
No? Okay.
Because my bachelor's thesis was about medical device regulation, so it looked at the legal aspect. So it has nothing to do with new product development. It's just that I use some background knowledge from that research.
Your biggest risk is a threat risk and an opportunity risk. Because once you get to talk to people, I'm sure your research question and all that stuff will drop out quite quickly and easily. Sorry, I have no idea who that was. my apologies. Right. I'll leave it then so I'll switch it off more quickly. So I think we'll go forward to being on, but unfortunately I'm in a position where I have to leave that on at the moment, right? Yeah,
Yeah.
You're quite well organised, I think, in the circumstances. I know you're getting worried, but I wish all the students had your worries, personally.
All right.
But I don't think you need to be too worried.
Well, that's personal perception, I guess.
I'm still worried I handed mine in.
Sorry?
I'm still worried I handed mine in.
So you said it's like well-researched area, right? Well-researched area.
It is not a well-researched area. There has been no research done
On risk management.
in medical
new
devices.
product.
Yes, exactly. I mean, there has been done for other products, like pharmaceutical, like we say in healthcare, and on IT project, like IT
But
products.
the life cycle you're talking about
Yes.
is probably fairly standard
Yes. I mean,
throughout, and you'll probably find there are processes and procedures in big companies for project management, risk management, issue management, all that stuff, and you'll find it's incredibly well documented. Right? Which isn't a problem, because if you do a little more research on it, you'll probably find that nobody's listening. And that's where I'm saying I think your questions will all fall out, because it would appear, if you look at the documentation, that it's all been done and there's absolutely nothing to do, and it's a waste of time looking at this. They've spent fortunes on it. But I think you'll probably find that nobody's actually doing risk management. It's actually awful. And the question then becomes, hang on, if you've got all those procedures and processes and you spent all this money on it, why can't you manage your risk? But I'm guessing.
Yeah,
I've got a sneaky feeling that you're worrying unnecessarily.
all right.
It's Hatch.
I have a question. These new medicines, they are developed like 7, 8, 10 years, right? One medicine in particular.
No.
You
No.
need to check.
Well, without going too much into detail, one of the problems in this field is that manufacturers have 2 opportunities. They can either take their existing products, modify them, and like bring them back.
No,
on the
let's say
market.
new product development.
Well, it's still a new product, because the thing is that this can take like 5 minutes, sorry. The problem about medical devices is that they need to enter the market and they need to get like an approval.
Yeah.
And in the US, that's done by the FDA, Food and Drug Administration. And there are two ways to do that. One is called the 510K process, and one is the PMA, straightforward, pre-market approval in this case. And if it's a really new product that has no aspect of a already existing product, you need to go the 510, the PMA path. The approval will cost it's going to cost around 75 million to get it approved, of which a big amount goes to the FDA, and it takes up to 5 years only to get the approval. That's after you did all the research. The 510K, in order to do it that way, which is a lot cheaper, it only costs around 25 million to get your product approved, and it only takes 6 to 12 months because they actually limited the time that the FDA has to have it done after 12 months if you hand it in all your documents. And in order to get the 510K approval, you need to show that it is essentially similar to an already existing product. And that actually hampers innovation at the moment because all manufacturers will go to 510K. Not all, but the vast majority of manufacturers will try not to come up with something super new. They will all try to link it to something that's already on the market because then it's cheaper and it's faster and it's just a smaller effort. So no, it doesn't take that long because all of them are just taking existing products and then redo them and then launch them again. But I mean, it's still a new product. It enters in a new name and it's a new market, hopefully, for the manufacturer. But that's a different question, whether innovation is hampered by regulation. That was the bachelor's thesis. That's done.
But give poor American companies a chance. I mean, they need 25 million, was it?
That they get that anyway.
And how many years?
Well, if it's the 510K, it's up to 12 months. If it's the PMA, it's up to 5 years.
That's right. Well, they need 5 years. You see, if people come up with genuinely new products, they actually win in America. And in America, you have to believe in free enterprise for American companies only. And they have to have 5 years to try to develop something to beat you with by the time you actually launch there.
Yeah, but then,
It's just the way it is. Believe me, if you've tried working in America, you will find that. Sorry, that's a very prejudice-sounding statement, isn't it? I'm not anti-American. It's just when they talk about free trade and capitalism, they mean not for themselves, I mean for them and the rest of the world.
yeah. So obviously medical devices are highly regulated. Not so much in the European Union though.
But you're going to study drugs or medical devices?
Medical devices.
Not drugs.
No, because pharmaceuticals has been done. I mean, not that I couldn't dig into that again, but I have no expertise whatsoever about pharmaceuticals.
It's sort of similar, only in some ways worse. It's even bigger lumps of money and because you have to do drug tests.
Yeah.
Really something.
Yeah, and the approach is, different. And the new product development in pharmaceuticals starts with looking for a molecule and then do like several tests and then try to get your prime molecule and then you go forward with that. And with medical devices, it's more like, oh, we need a pacemaker. And then you do a pacemaker and you need a hip implant and then you come up with a hip implant. And then you might add some, new metals or, really the new products are only, most of the time it's new materials because the kind of sicknesses kind of stay the same that are treated, knee, hip, heart, brain, basically. That's about it.
So you've talked only to your supervisor about this?
Well, in my supervisee group, like there are more students. Not sure they understood though what I'm planning to do.
Sorry.
Well, we're 5 students and like 2 supervisors kind of. So I obviously
Who
told
is your supervisor?
Alec,
I
Theory,
thought so. Oh, so Alec works with
Dennis, Silverwood.
Right. Yeah, right, okay.
Yes.
But we have other professors, right, who's working on this subject. Like Christopher James.
well, the people who are here at the, like, who do the digital healthcare program, which is not running this year, they have a different, like, they are not interested in medical devices, or, well, it's more about everything digital in this like in this WMG thing with healthcare. It's all digital stuff, remote treatments, and I don't know. I mean, I talked to somebody, I think it was James Hart, some James with an H in the last name. And yeah, he said that none of his actual people that go do with him the digital healthcare thing come from
So
medical
what
devices.
about that guy who taught us new product development module?
Yeah, well,
Daniel?
Daniel Stranger. Well, the thing is that I wanted to go with him as a supervisor, but then didn't decide for him, and I'm pretty sure he's not my biggest fan at the moment.
But maybe still you can ask him.
Yeah, no, I mean, he sent me some materials, and I mean, I talked to him about the idea, so. It's just that I wouldn't rely on him in the first place, obviously, since he's not my supervisor, and he has other students to supervise.
It's an amazing special idea. I mean, Sue, you met my wife, was here this week. She was around the regulatory department for in pharmaceuticals, starting in Smith region. But that was for drugs, and that's quite different than this, though extremely similar. It's the same word. It's amazingly one-off medical things because of regulatory affairs.
People who work in regulatory.
You have to get approvals in every country, and they have their own. I mean, approval in Japan. The Japanese insist on tests on monkeys and God knows what, that everybody else has stopped testing on years ago. Now, the French aren't that extreme, but they insist on some tests that the Americans don't ask for, the British don't ask for. And everybody insists on some tests, and everyone's independent.
But that's, by the way, that's one of the advantages of the 510K, that
That's
you
right.
do not have to conduct new clinical testing. And one of the reasons why the PMA costs so much money is that you have to do new clinical testing because you can't prove that the old testing of the essentially similar product applies to your new product. So another reason why manufacturers would rather go with something similar. Nobody likes it.
I think it's best to, it's very specialist, and this is a unique way. But I think you're very well organized and should make it from here.
Okay. Fingers crossed.
So, sorry, what was your aim?
Well, to identify the risk, associated with each phase, and then explore if and how the risks is managed by the teams involved.
Will be like more descriptive, right?
Yes. Well, I tried to figure that today, whether it's explanatory, exploratory, or descriptive, and it has a little bit of all, because, I mean, I'm saying that nothing has been done in that field, so that would be exploratory, but it's not really, because it's not a new phenomenon. I mean, it's just looking how it's done. But descriptive, I think, is not the how.
Yeah.
It's not, I think.
Okay.
My worry would be that you may find, I mean, you're still running, I suspect, this is a guess on my part, an assumption. I think you're running with the idea that there will be risks that are typical risks for concept development, and risks that are typical risks for project definition and planning. You keep talking about identifying the risks for each phase. Now, you may find, whilst every new product development goes through the same life cycle, it may not be possible to have risks for each phase. assumption in that statement I don't think you've recognised. The first thing is to find out, are there typical risks for each of these? And is this a good way to categorise a risk? And if not, what is a good way? So that puts you even back further than you thought you were in terms of defining the project. But again, don't worry.
Yeah, no, I figured
Because
that.
you will find risks and you will be able to categorise them.
Yeah, no, I figured that my project at the moment anchors a little bit on, too much on the life cycle, like in the way I wrote it, the anchor is the life cycle, and then I identified that.
Well, the whole of Prince is written like that. People find out this word's a life cycle and then they get hooked on it and they hang everything on it because it's some answer. And then doesn't believe it is most of the time, I think.
Oh gosh. So risk management is not only about identification of risks, it's also about risk mitigation, risk acceptance.
Yeah,
What about this?
I haven't written it there. I mean,
Let's start at the beginning of work. It's a research project.
Yeah.
She's got to get to the point of defining the risks first.
So
that's why I said that I want to do semi-structured interviews, so there's some room to go right and left,
yeah.
besides just finding how risk management is conducted, or if it's done, also to ask maybe for the mitigation strategies they have.
Everybody else is being very quiet. I would be very happy if everybody has got as well-structured a presentation as this. How are you all feeling? Do you think I'm right? Yeah, it's not about anybody. I don't think you've really got a problem at this point. It's about getting on with it.
What about other two?
Yeah,
questions?
I'm curious about that as well.
Okay, so the other one,
Other two.
I said that I have 3 ideas,
Oh, right.
I'm only presenting one. So, I already told some people about the Berlin Airport project, which is a little bit off the medical device industry here. But,
Say that again, but you drop that.
what?
Or are you still going to go with it? Or you...
Yeah, I mean, I still have it. Today I just wrote 3 pieces of
Okay.
paper with the
Right.
3 ideas and then just basically made a decision. So that's what was the outcome of that. One is about the Berlin project, Berlin Airport, which is still not open. It was supposed to open in 2008, and it's not going to open until 2015, and maybe it's never going to open. Who knows? So obviously that something went wrong on the way between 1992, when they decided to have a new airport, and today, when there's a big question mark about what's going on. The airport is there. I mean, it is standing there. The building is complete. Everything is fine, but it's not open because of several problems. The reason why I'm probably not going with that one, although I'm super enthusiastic since I think it's ridiculous, because of my tax money spent on that airport, is a lot of people are worrying or concerned what's actually going on there, and there's almost no documentation. And the people who work on that, I mean, they still work on that project, so they are most likely not to give me an interview when they don't even speak to, official authorities, and their department requested that somebody tells them what's going on. But the last 2 meetings didn't happen because apparently the Berlin mayor disappears all the time when he's about to say something. Because the Berlin mayor is at the same time the head of the board of directors, because the city of Berlin is the prime shareholder in that airport. And he had to step down from that role, but now he's not saying anything anymore. And the project manager, everybody knows his name, but I'm not sure whether he's in France by now or in some other country.
So it's going to be investigations.
So, yeah, I mean, there are investigations going on at the moment because somebody has to determine what needs to be done. But they need to rip open all the flooring, which is 10,000 square meters. I don't think anybody started with that. So for 10 months, nothing has happened at the airport, and at the moment, nobody's working there, except for some security staff and some cleaning people. So who knows? Maybe it's not going to open. We don't know. But yeah, so there's no documentation basically.
It was stopped from opening because it failed
Sprinkler systems and fire. It's apparently built overcomplicated. That was the message that has been sent out. Yeah, so it was supposed to open last June, finally. Everybody got super excited. We were able to book flights from that airport. And then mid-May, 3 weeks before the opening, they announced that it's not going to happen. And now a lot of people are in trouble, but the really important people are not in trouble, of course. It's just people who wanted to have stores in there. And I mean, it's really sad for some people. One of the biggest airlines in Germany is actually probably going bankrupt before the airport opens because they were supposed to have every third flight from the new airport, and they sold tickets for all these flights that were supposed to happen and that did not happen, and they had to reimburse people, and they bought new airplanes and everything, and they are probably not going to survive that. But that's a different topic. And the third one is also related to medical devices, and it is, it was the question whether, whether early adopters of project management, like defense and petrochemical industries, who like started really early adopting project management methodology into their business, have like how the maturity of project management in their organizations compared to late adopters, like the medical device industry, is. I'm not sure whether that makes sense.
It makes sense,
So like how mature is project management across several industries, and then the comparisons between like early and late adopters in this case?
How far have you developed this idea?
I'm not very.
Have you got a presentation on that?
No. No.
That could be quite difficult. How do you define maturity?
Yeah, well,
When did it, I mean, Richard Watson would say that construction was one of the early adopters.
well, I've read something where somebody did something similar, and they actually compared finance and construction to defense, and they found that there is a connection. I mean, they said that further studies need to be conducted, but yeah, they identified 10 areas from like how multi-projects are managed to leadership, task ownership, like they had 10 categories, and they found that defense is indeed more mature. Like they had a scoring system from 0 to 5, and then that's apparently pharmaceuticals were the least developed. But yeah, in the end they said that more research should be conducted on this one. So I'm not really far with that idea. It was more in the brainstorming phase that came up as well.
Is defence more mature than construction?
I can look it up for you.
I'd be quite interested
Yes.
because, I mean, defence overruns are still massive. Construction overruns always now happen.
I'm pretty sure that defense
If
was
they do happen,
most mature in all areas.
Yeah.
In that,
Yeah, and yet, what is risk management for? Now, it's
but
only,
that was not about risk management, that
Project
was about project management.
well, it's project management, yeah, what's project management for? Thing is,
They used the PM book maturity model, by the way,
Yeah.
to measure maturity in that study.
the defence industry now belongs to about 4 or 5 companies. There's one huge one, which is BAE Systems, and it's been created by the MOD. This is because some idiot in government decided if Britain is going to compete with America, we need a big defence supplier to compete with big American companies. Of course, we haven't got a big aircraft manufacturer or a big anything. We've got a big company which makes submarines, service ships, tanks, aircraft, and everything else called BAE Systems. As a result, the MOD is virtually got a monopoly supplier. So if BAE overruns on anything, at the end of the day, everything the MOD's got to shut up and pay the bill, and find a way of doing it without people asking questions in Parliament. BAE went bust, Britain wouldn't be able to run an army at all. Well, we already buy a hell of a lot from the Americans, we'd have to buy everything from the Americans, we'd be totally dependent on America. That doesn't make sense at all. Anyway, defence projects overran in time and cost phenomenally. Construction projects rarely do. And when they do, like Wembley, the supplier gets compensated, and the actual project management is far more effective in the construction industry. You rarely have construction companies going bust. The only reason, their project management is much better, is what I'm saying. But it doesn't look as mature, so...
Is it because of project management? Maybe it's because of product. I mean, they always creating something new. Defense.
Well,
Not construction.
Wembley Stadium roof is new, the Shard is new. I mean,
No,
if you look at technology,
I mean, there is a
construction
method
has
for
changed
building it.
phenomenally.
I mean, there is a method for building it. But aircraft, for
Well,
example.
Look at the building you're in.
Yeah.
Now, the design and materials and everything about this building, nothing like this existed 50 years ago.
But there is still like construction standards, and etc. I mean, wall is wall, door is door. I mean, it's nothing like very inventive. I mean, but
I'm
aircraft.
sorry, that wall is hanging from that metal girder. It is not standing on that floor.
I mean, it's
Right.
not inventive. Right?
Now, the more traditional buildings, you've got a foundation and walls, and everything is hanging off the walls.
Yeah.
Now you drive piles, stick a frame up and hang the lot off it. It's entirely different.